Hi everybody, I am Dr. Britt Talley Daniel MD, and I'm a headache doctor, member of the American Headache Society, and a neurologist, and member of the American Neurology Association. I have a big blog on migraine, which is drmigraine.com. We have a lot of articles there. I have the article I'm going to talk about today posted there. Today I'm talking about, does Botox work for chronic migraine? And I appreciate you folks hitting my subscribe button over there so you can follow me. So I'm going to put more YouTube videos up, and I already have a number of them up for migraine already. So Botox, what is that? It's called onabotulinum toxin A. In the world it's colloquially known as Botox, which is a famous dermatology beauty assisting facial line erasing drug. It also works for chronic migraine and has an indication with the FDA for migraine prevention for patients who have chronic migraine only. Chronic migraine is defined by the International Classification of Headache as being 15 headache days a month, 8 of which have migraine features. Migraine features are one-sided throbbing, severe, associated with nausea, vomiting, sensitive light or sound, features like that. Botox does not work for episodic migraine, which is defined as less than 15 headaches a month, or for tension type headache. It's a neurotoxic protein produced by the bacterium Clostridium botulinum, and it prevents the release of the neurotransmitter acetylcholine at the neuromuscular junction. So the nerve goes to a muscle, and there's a little junction there, and there's a chemical secreted in the body that goes across that synapse between the nerve and the muscle, makes the muscle contract, and Botox works there to block it. It can cause paralysis of striated muscles, there's normal muscle in your eye, diaphragm, arms, and legs. If you get an infection with it, it's called botulism, and it's marketed in the United States as Botox. But botulism is a very severe illness if you get it. It kills people. It's rare, but it's a very serious illness. The Clostridium botulinum bacterium is a anaerobic, gram-positive, spore-forming rod found in plants, soil, water, and intestinal tract of animals. We get it by ingestion in our stomach. So if you get botulism poisoning, that can cause limb paralysis, trouble breathing, and sometimes death. It can be used as a biological weapon. It has been done that before in the past. 1 gram of botulism toxin could kill over 1 million people, and 2 kilograms could cure the entire population of Earth. Wow. So the question is here for the talk, does Botox work for chronic migraine? So yes, it received FDA approval for treatment of chronic migraine on October 15th of 2010. This toxin is injected through a small needle in the head and neck, around the eyes, and the back of the head to treat chronic migraine. Approval of the drug followed evidence presented to the FDA from 2 studies funded by Allergan, who are the makers of this, that showed very slight improvement in the incidence of chronic migraine for people who got the shots. Generally, it takes 4 or 5 days for the shot to kick in and work, and it lasts 8 to 12 weeks. So usually the shots are given every 3 months or so. And you're supposed to take it at least 2 cycles, so that would be 3 months, and then another 3 months. And if it doesn't work, then it doesn't work. But for people it works, it should work within the first cycle. Exactly how it works is that it blocks the motor nerve transmission, also blocks the sensory transmission. What does it feel like to get one of these Botox shots or a series of shots? Usually they're given 31 shots around the head, the eye, temples, and the back of the head. Patients describe the injections as like a tiny prick as the needle goes in a shallow distance in the muscles of the face, the jaw, the muscles of the back of the head. It works best if given in a protocol, which usually is given in a doctor's office. It's an outpatient procedure. You don't need anesthesia for it. Side effects from it can occasionally be trouble breathing, drooping of eyelid, which is called ptosis, trouble talking. It depends on where the chemical goes in terms of the muscle it affects. You can have double vision from it, blurred vision, drooped eyelids, hoarseness, change in loss of voice, or unclear speech. Now, what does it cost? Most insurance companies will cover Botox therapy only for chronic migraine, but the patient should talk to their individual insurance providers and see what they say. What's the effectiveness of using Botox for chronic migraine? The maker, Allergan, says that some patients in the company-sponsored trial experienced 50% reduction or more in headache days per month after 2 cycles, and that more than 2 out of 3 patients showed some improvement. That's a quote from Botox, the maker of the drug. However, nobody else has achieved these same results. In April 24th of 2012, there was an article in the journal American Medical Association, the JAMA as it's called, that Botox injections are, quote, only modestly effective for treating migraine in the most frequent sufferers. So the researchers looked at 27 published trials regarding Botox for migraine. And what it did was it prevented 1.8 headaches a month more than placebo. Placebo is like a phony treatment. And human beings have a reaction to placebo, particularly for pain or something like migraine. There'll be a strong placebo reaction from any kind of treatment. So the patients get an injection that gives you a placebo response. What was overall was looked at if there was 1.8 headaches a month reduced more than placebo. The researchers felt that Botox was no more effective than commonly used migraine preventive drugs, which at that time was drugs like amitriptyline, topiramate, Depakote, and Inderall, beta blockers. This was a drug study done before the invention of the CGRP drugs that came out in the summer of 2018. And in fact, I haven't been able to find, I don't think there are any published articles that show comparison in a drug study trial, the old-fashioned use of Botox in the typical fashion it's used, as opposed to one of the new CGRP drugs like Aimovig or Emgality. I don't have any data there. So the only data we have is on the older drugs. And what was stated was it was no more effective than the commonly used older drugs. It's also stated that there's a high placebo response with Botox used. A headache specialist at Johns Hopkins University published a paper that I saw. His name is Satnam Ninjar, MD. He said, quote, the research analysis will surprise few clinicians working in the field, that is headache doctors, and the review emphasizes that most patients experience only modest benefits, but we already knew that. What are the problems in using it? Well, my experience as a headache doctor and seeing patients in my office is many doctors haven't completely eliminated or discussed or worked with the patient to eliminate medication overuse headaches. The most common cause of chronic migraine is medication overuse headache. These are patients taking too much headache medicine every day, and that causes the headache problem. So I've seen patients in my office, another doctor was giving Botox, the patient was still taking opiate narcotics or caffeine or Tylenol or NSAIDs regularly, and those drugs could cause a headache, and if the doctor would educate the patient regarding getting off those drugs, possibly they can get better on their own without using Botox. So what's the data on that? The International Classification of Headache criteria for medication overuse headache are taking triptans or ergotamine. Triptans are probably the best acute therapy drugs in the world. They came out in the 90s, drugs like Imitrex, which is now called sumatriptan, and there's 7 triptan drugs available in America. So if you take one of those drugs, or ergotamine, if you take one of those 10 days a month, that can cause daily headache. If you take non-opiate simple analgesics, it's 15 days a month, such as Tylenol, Advil, caffeine, stuff like that. Or if you take opiate narcotics or barbiturate drugs, opiate drugs, there would be Vicodin, Tramadol. Barbiturate drugs would be Fioradol, Fioricet, and drugs like that. If you take one of those 10 days a month and give you headache, really those are probably the worst drugs to use, the barbiturate drugs, because they have such a long half-life and they stay so long it's hard to detox the patient off of it. Where it's easy to get somebody off triptans or get them off caffeine or Tylenol, but try to detox someone off opiates and barbiturates takes a longer period of time. So what's the bottom line here? Well, for good migraine treatment, the patient should do the migraine lifestyle. What is that? Well, no caffeine, 3 meals a day, exercise aerobically 3 or 4 days a week, which the American Heart Association says everybody's supposed to do that anyway, for 20-30 minutes. Set your sleep pattern, get up and go to bed same time every night. Don't nap or oversleep. Deal with stress. And don't overtreat with over-the-counter drugs like NSAIDs, caffeine, triptans more than 2 days a week. And don't ever use opiate narcotics or barbiturate drugs for treating headache at all. Get on a migraine preventive drug. Right now, the CGRP drugs are the drugs of choice to use, and those are named Aimovig, Ajovy, or Emgality. Those are given by a subcutaneous injection, either around the abdomen or in the thigh once a month. I tell my patients in the office who are needle phobes and don't want to get the shot, that insulin-requiring diabetics get shots like that 4 times a day for life. So, this is the end of my discussion on Botox for migraine headache. Good luck to all you folks, and I'm sorry you've had the headaches, and I hope you do well with it. Go see your doctor and talk it over. Don't overtreat. God bless you all. Goodbye.